Good evening, and thank you for attending tonight's webinar that is being hosted by our Physical and Mental Health Committee, and to the committee chair, co-chairs, and committee. Thank you so very much for bringing us this opportunity this evening. I am Ruth Price Rollins, and I am the president of the Greater Cleveland Alumni Chapter of Delta Sigma Theta Sorority, from which I bring you greetings. I welcome you to tonight's webinar that is hosted in collaboration with extremely trusted medical professionals. We believe this to be a very, very timely discussion as we celebrate the holidays and we hold many gatherings. Tonight's webinar will raise awareness about respiratory viruses that we have heard about on the news and ensure that we are able to protect ourselves and our loved ones during this season. I will now turn it over to our Physical and Mental Health Committee to introduce our speakers. Thank you for being here this evening.
Thank you. And thank you everyone for joining in. Tonight's webinar is one of several events that we've had over the past 8 months that promotes prevention of common diseases through education, as well as vaccination, in collaboration with the National Council of Negro Women. Delta Sigma Theta and other sororities and fraternities continues to prioritize the health of our community and has agreed to take the lead in providing resources to promote wellness in our community. I have the pleasure of introducing our speakers for this evening. First, I'll introduce our moderator, Dr. Leanne Moore. Dr. Leanne Moore obtained her Bachelor of Sciences degree in Pharmacology and Toxicology from the University of Toledo and a Doctor of Pharmacy degree from the University of Kentucky. She is dually board certified in pharmacotherapy and infectious diseases. Currently, Leanne is the co-director of pediatric antimicrobial stewardship at Rainbow Babies and Children's Hospital. As a pharmacist in this role, she ensures that children are on the best medications to treat infections. The Antimicrobial Stewardship Program, with her co-leadership, has garnered national recognition as a center of excellence by the Infectious Diseases Society of America. She also holds her membership in Delta Sigma Theta Sorority Incorporated near and dear to her heart. Other panelists for this evening is Dr. Lynn Milliner, who is a pediatrician at Metro Health Medical Center, and she served as the former medical director of the City of Cleveland Department of Public Health. She is a graduate of Case Western Reserve University School of Medicine, and she has spent over 2 decades caring for children in our community, offering her medical expertise through service on medical boards and advancing the profession of medicine through research and health policy. We are so fortunate to have you with us this evening. Dr. Milliner is also a proud member of Delta Sigma Theta Sorority Incorporated. So welcome to both our moderator and panelists, and I will turn it over to the two of you.
Good evening, everyone. Earlier this month, the CDC issued an official health advisory. The advisory notified the medical community about early elevated respiratory disease incidents caused by multiple viruses occurring especially among children and placing strain on healthcare systems. The health advisory stated that co-circulation of respiratory syncytial virus, RSV, influenza viruses, SARS-CoV-2, also known as COVID-19, and others could place stress on the healthcare systems this fall and winter. This early increase in disease incidence highlights the importance of optimizing respiratory virus prevention and treatment measures, including prompt vaccination and antiviral treatment. Dr. Milliner, many of these community respiratory illnesses have the same symptoms. Can you tell us what RSV, influenza, and COVID are, and discuss how they are the same and how they are different?
Great, and I want to first of all thank the committee for having me speak to you once again. A lot's changed since we last met, but a lot hasn't changed. So I would say stop me if you've heard this before, but some of this you do know. Most of these illnesses, as we know, are viruses, and they all have a very few things in common. So your typical cold, cough, runny nose, fever, headache, body aches. We know too, having had COVID for a while, one of the unique things about COVID was the change in smell and taste. And that we didn't know when COVID first came out. We also know that RSV tends to affect the younger population, especially premature babies, kids under 6. But like most diseases under 6 months, excuse me, it also affects the most vulnerable of our population. So you always think age extremes, very young and very older and seasoned individuals. I don't want to say just old folks, but on the older ends of the spectrum. We also know that if you think of flu and a cold, colds and flu tend to be more self-limited illnesses. So you get the flu, it kind of knocks you out for maybe 5 to 7 days, maybe up to 10 to 14 days, same with a cold. But now we know that COVID is long haul, and that long haul can be several weeks to several months. RSV is similar to cold, so unless you're hospitalized with bad RSV, if you're a young baby or you have pneumonia, your illness is going to be self-limited. But COVID, unfortunately, can be here to stay for a very long time.
Thank you for explaining. We often hear that there are different strains of the flu, and we learned about the different COVID-19 variants. Can you help us understand what that means and why influenza vaccines are needed every year and why there are so many boosters for COVID-19?
So I'll start with the easy one first. The reason why we have annual flu vaccines is one, your immunity to flu from a previous vaccine wears off. And we know that to be true for COVID vaccine as well. While we're still new in the COVID arena, we do know that the immunity that you get from any vaccine is not permanent. We use data from last year's previous flu season to dictate what you get in this year's flu. We always look to our Australian colleagues to let us know the flu numbers. So if Australia says we had a bad flu season and it was mostly influenza A, your vaccine for flu this year will contain influenza A, and that's what we're seeing right now. So it is somewhat reactive, and we try to be proactive at the same time. The reason why we have so many variants for COVID, if you think of any virus like the branches of a tree, every branch on that tree is not identical. And what COVID and most other viruses find a way to do is make themselves unique. What's made the variants different, for the most part, is they're not making people as sick as the original variants of COVID, but they do make them much more contagious. So you may have milder disease, it's just faster to spread. And unfortunately, part of the reason why we're seeing such an increase in RSV, in flu, and COVID is because all of the measures that we put in place, say the first 2 years of COVID, where nobody went anywhere, nobody had anybody over, we masked, we distanced, we bought out all the hand sanitizer and wipes we could find, and we've lifted some of those restrictions. So these viruses have said, yay, there's an open door for me. And they have taken advantage of, our need to get back out, but also not just financial, but social, but very good reasons for getting back out and lessening those restrictions. And then this is the unfortunate side effect from that.
People are often concerned about the contents of a vaccine. Can you tell us what is in the COVID and influenza vaccines and how that helps prevent illness?
Right, so COVID is probably your most recent one. That was developed from a messenger protein that they had grown from the virus. It was never active virus. It's a protein that triggers your immune system to respond to something that's foreign. Influenza viruses were developed differently for their vaccine. They're grown in an egg product, and it's inactivated vaccine. So anyone that says, oh, I got, the flu every time I get the flu shot, it's not a live virus that they're giving you. It's inactivated and it's killed. Even the one that's a nasal flu vaccine is not an active virus. So you can't get flu from it. You can't be contagious. I think people may have thought that the mRNA that we use for COVID meant we used DNA. We do not. It's an artificial protein. The Moderna virus used a little different messenger to introduce their immunity for the vaccine, and they used a manufactured viral protein, not COVID virus, just a virus that would trick your immune system into saying, like, this is not right, it shouldn't be in my body, I need to fight it. So all of those vaccines that are available now are not live. They've never been live. You can't get the disease from it. But as you know, as most things in life, a rumor isn't a rumor that won't die. People will always think, and I think a lot of people that didn't get vaccinated still think that there are live pieces of COVID and live pieces of flu. I can't tell you the number of patients that I have seen that will get their COVID vaccine, but still won't get their flu vaccine. And I'm not sure why. I have a 97-year-old relative that's gotten every COVID booster, but still won't get a flu shot. And so we have conversations about it, but I haven't been able to move that needle. So I think part of it is people think that if I get the flu shot, I'm going to get sick. As you know, there are side effects and it's your immune system responding to it, but it's not the actual virus that's making you sick.
So now that we understand a little more about the COVID-19 and influenza vaccines, can you talk about eligibility for vaccines? At what age should we start vaccinated against influenza and COVID-19? Are there any people that should not receive a vaccine?
Right. So the people that should never get vaccines are ones that have an anaphylactic, that's a severe allergic response to any vaccine in the past. So those are incredibly rare, and the number of people that reacted to COVID has been just as low. And we do have a monitoring system for that. So there, you know, in the beginning, people thought, well, I couldn't get the COVID vaccine if I had an immune deficiency. Actually, the opposite is true. We want you to get COVID vaccine if you have a weakened immune system, because you're less likely to be able to fight off the virus. The good news is COVID and flu are available from age 6 months on up. And I know people, you know, worry about, oh my goodness, should I give it to a 6-month-old? Absolutely. 6-month-old don't have intact immune systems. And where do they get COVID from? From older relatives. They get flu shots too. So we've had a rash of babies this week and older adults this week who had COVID and flu. Now their COVID is not as severe, but flu can still make you pretty ill. COVID in the beginning led to a lot of cases of pneumonia. Doesn't lead to that as much, but flu does. So we really do want to protect those outside age groups. So younger babies, yes. Older individuals, yes. And certainly people that have immune systems that are weakened. So if you have chronic heart disease, chronic lung disease, any autoimmune disorder, you should be first in line to get your vaccine and get all your boosters up to date. Sadly, we don't know how many COVID boosters you're going to have to get because we're still new in that game. And the older vaccines, the initial ones that came out, don't protect you against Omicron, right? So now the Omicron's in the booster. And the reason why we do it Omicron is just because it was much more contagious and spread a lot faster. So that's what COVID did that was smart. You know, it's always important to remember that you can be symptomatic and contagious even before you start showing even minor symptoms. So it's really important the best thing you can do is protect yourself with the most up-to-date vaccine available.
We have talked a lot about COVID-19 and influenza. Can we talk a little more about RSV? We continue to hear on the news that pediatric hospitals are filling up and that there are no beds available. Is it correct that there is no vaccine yet available for RSV? Is the increase in RSV the main contributing factor to the strain on the healthcare system?
I would say yes, it's been an incredible strain on the healthcare system, and there's not yet a developed vaccine for it. The reason why we saw the increase in RSV this year, 2 reasons. One is because the precautions are lighter, but also because the season peaked earlier. So RSV usually is more a disease of later fall when it's colder and early winter. This year, we didn't have that opportunity. RSV kind of snuck in when we weren't prepared for it. So we started seeing increasing numbers in RSV in October when we weren't prepared for that. It's usually a very mild, common cold. Most kids, by the time they're 2 years old, will have had at least one RSV infection, but it affects children that are younger, children that were born premature, children that may have chronic asthma problems, so they're more at risk to get RSV. And it can affect older adults now, so it can put them in the hospital. It is really more a disease that's more respiratory than, say, like your COVID or flu. And for little babies, it will cause them to be dehydrated and have breathing difficulties where they'll need support. So it's really important that they get, you know, protected. And I guess that really for younger kids, the best thing is protection and prevention, right? So since there's not a vaccine for it, trying to limit the people that you're around, you know, we always go back to old school, you know, hand washing, covering your mouth and nose, limiting your social events. And, you know, we may have to go back to that a little bit, you know, not a lot. We don't want to go back to where we're all holed up in our houses and separate from each other, but, you know, making sure if you're not feeling well, then maybe you shouldn't go to an event, right? And if other people tell you they're not feeling well, please, you know, don't don't make them feel bad for staying home, because it'll always kind of peak and surge a little bit around holiday times because, you know, people come in, they didn't know they're sick, and then they get back home, and then they either test positive for flu and COVID. And we're doing a lot of flu testing. Thankfully, the RSV is starting to stabilize a little bit, but it really did hit us hard and hit us very hard from the very beginning.
Thank you for that. Is RSV treated differently in the elderly population?
It is only in terms of, do they need extra respiratory support? So the comparison and contrast with, for older people, they tend to get more pneumonia if they get a bad RSV infection. And it really does affect not necessarily normal healthy adults, but adults that have things like COPD, asthma, you know, uncontrolled diabetes, weakened lung systems, frequent bouts of pneumonia. So their lungs are already fragile as it is, and RSV just attacks that. For younger kids, it tends to be they have breathing difficulty to the point that they need extra support like oxygen. They may need breathing treatments like the typical asthmatic would use for albuterol to keep their respiratory tree open. And then they're also coughing so much and breathing so fast that they often get into trouble, don't eat, and get dehydrated. So we don't see as much dehydration and breathing difficulty in adults. We see more pneumonia in adults and more breathing difficulty and dehydration in younger kids.
Sometimes it's difficult to find a location to be vaccinated. Are there any places that you can walk in and be vaccinated locally?
Thankfully, most of the pharmacies and public health departments have been doing a great job with supply. So you could walk into now a Marks, a Walgreens, a CVS, a Rite Aid, a Giant Eagle. Your hospital system pharmacies have a good supply. As you know, in the beginning, that was not the case. We had more demand and didn't have enough vaccine. And then for a time we had more vaccine and not enough demand. But right now, I think we're in a pretty good place that anybody that wants to get a COVID vaccine shouldn't have any difficulty getting a COVID vaccine. The same is true with the boosters. There might have been a little lag at the beginning in getting all the boosters out, but we're making sure to keep that supply available so that people that want to get vaccinated can get vaccinated. So we're not seeing that as much of a problem as we did in the beginning.
Are there any general strategies for preventing respiratory viruses for vaccinated or unvaccinated people as we gather with family and friends this holiday season?
So I would say if you're unvaccinated, so I don't advocate that people, you know, find out who's vaccinated and not when you have holiday gatherings. But if you're not vaccinated, you know, and you don't necessarily have to share that information, but take extra precautions. So if you choose not to or don't get vaccinated, make sure you're really careful about hand washing, trying not to touch your face, your eyes, your nose, your mouth, because we do that a lot, you know, and people do studies like how many times we do this or we do that, and then you touch something, and all of these illnesses are spread by contact, right? So whether it's respiratory droplets or it's on surfaces that aren't cleaned as well, it's really important. So we'll always go back to hand washing and hand sanitizing. If you're sick, we want you to stay home. You know, if you've got a fever, you've got a little cough, I can't tell you the number of people that call and say, well, I know it's not COVID, I know it's just a cold. Well, I don't know that, right? And unless you get tested, you may not know that either. And the last thing you want to do is, you know, go to a gathering and come back home, you really don't feel well and you test positive, and now you got to let everybody know that you expose them to being positive. So, you know, use your best judgment. A lot of people are traveling now, so I can tell you I've traveled recently. I'm probably one of only 5 people on a plane that still wears a mask, but I still wear my mask on a plane. I still wear my mask in a grocery store. Now, I'm only the only person in a grocery store because I go at 7 o'clock when they open, but I try to minimize some exposures, right? So I don't tell everybody to stay home and go back to the dark days, but do limit, you know, and use your best judgment, but make sure, you know, always hand washing, covering your mouth and your nose when you cough with your sleeve. Now, I grew up with your hand, right? So a lot of us may still do that. We want you to cover your sleeve because you don't have to necessarily wash that every time. But if you do forget and you cover your mouth with your nose, with your hand, cover your nose with your hand, you should wash and sanitize your hand after that. And then when you're feeling not well, you know, consult your primary care provider or your healthcare provider to find out should you get tested or what the next step is for you. It's really important to remember while we don't have treatment for RSV. We do have treatment for flu, but you've got to get that medication within the first 48 hours. And similar for COVID, if you're older, we can treat you with Paxlovid, but you've got to get that treatment early on in disease. We can't give it to you 5 days later, even if you have long COVID. So the earlier we identify an infection, the better we can help you get better, right? But the biggest one is prevention. Get vaccinated, but if you choose not to, make sure you limit your exposure and make sure you do all of the infectious disease protocols that we recommend to keep you and your loved ones safe.
Thank you. We will now take some questions from the audience. I will read the questions in the chat. For the first question, Dr. Milliner, can you explain what is herd immunity?
So herd immunity, it sounds like a complicated scientific term. It's not. It's the magic number when enough people have either been vaccinated against the disease or have had the disease where we know not consider it, like a pandemic or endemic. The downside for COVID is we will probably not reach at least natural herd immunity because there's still a significant number of people that haven't gotten vaccinated, right? So so it's a combination of two things. You have to have a lot of people vaccinated and a lot of people have had the disease. We can make one argument, yes, that a lot of people have had the disease, but not enough have been vaccinated for us to get to that magic number that would say we have herd immunity against COVID.
Thank you. The next question is, I can answer, is there anywhere to get free home COVID tests? There used to be a government website that provided for free home tests. That is no longer available at the moment due to a decrease in the funding for that. So at the current moment, I'm not aware of any place where you can get those home COVID tests anymore.
Right. Hopefully that'll come back, but not right now.
Does it matter if you started with Johnson & Johnson, but use another brand for the booster?
No, it doesn't. I think it used to. I think when they initially said when you got your primary series, you should, continue with the primary series. And a lot of that was based on things we did or didn't know. We didn't know if you could mix the doses, would you still get the same immunity and protection from COVID? You do, and we got to the point now, we want you to get whatever COVID vaccine is available to you at the time. So if you started with Pfizer, can you get a Moderna booster? Yes, you can. The only time there was some problems with Johnson & Johnson, if you were of childbearing age, there was that worry about the risk of blood clots. So that one, it kind of fallen out of favor, but people like Johnson & Johnson because it's only one shot, right? But now we're okay if you mix and match. We just want you to get protected.
The next question, if we've been vaccinated and received the booster shot, should we isolate if we believe we've been exposed to someone that tested positive for COVID?
Yes, I would still recommend, and the CDC still recommends that you monitor for symptoms for 5 days. And if you're symptomatic in that 5 days, you should get tested. Right. So that's say if you develop a fever or you've got a cough or a runny nose or a sore throat, you should get a test. And then even though the number shifted from 10 days to 5 days, we recommend that you monitor for 5 days of symptoms, but still do some closer hand washing and mask wearing until you're out of that 5 days in the event that you got exposed enough to be positive so that you're not increasing the risk of spread to others.
Is it recommended to take an official test at a pharmacy, hospital, health center after taking an at-home test, or is an at-home test just as accurate?
A home test is just as accurate now. I think when they first came out, there was a lot of, misinformation and mistrust in the home COVID test, but we consider them just as accurate because I always kind of make the counter argument. Say you get 3 COVID tests and you get them at 3 different places and 1 is positive and 2 isn't. Nobody can tell you which one to believe, right? So I always take the positive over the negative. So if you have any test that's positive, treat it as positive. People like to do confirmatory tests. It's really not necessary because if the test picked it up, it's there. And sometimes a different test has a different threshold for level of virus. And that's a lot of, scientific double talk. But if you've got a positive test, treat it as positive.
What is para-influenza and how does it differ from influenza?
Para-influenza is also a respiratory virus, but very different from influenza. Para-influenza usually causes just like common cold symptoms, so it doesn't cause the fever, the body aches, the fatigue that influenza does. It very rarely leads to pneumonia. There are probably about, I want to say between 10 and 20 common respiratory virus. Para-influenza is one. There's metapneumovirus, parapneumovirus, and we don't test for those because it really doesn't change the management. They're all viral illnesses. We'll all do rest in fluids, and we say that a lot, and it sounds like a broken record. But the best thing to cure your viral illness is time, with the exception of COVID that we can give an antiviral, and influenza that we can give an antiviral for.
I'll be starting with the VNA during this RSV season to assist with pediatric patients, providing Synagis injections, which assists premature babies to prevent RSV. Is there anything equivalent for the geriatric population due to not having an actual vaccine?
Not yet for RSV, so it really would be more limiting exposure. And then if you're concerned that you as an older individual have RSV, we can test for RSV, we can test for influenza, and we can test for COVID. It would be ideal if we could test for all three in one swab, but we're at least able to test for 2 of the 3 in swab, and it might be 2 swabs to test for both. But really important to know, because some people say, well, I think I have this, do I really need to get tested? Yes, when it comes to COVID and influenza, because there are treatments available, and the earlier you test positive and the earlier we know, the earlier we can get you treated.
Can you receive more than 1 vaccine at a time?
That's an excellent question, and yes, you can. Back when the vaccine first came out for COVID, they frowned on that because we didn't know if it was safe, right? And it's all things in time. So once you got your COVID vaccine, we would tell you that you couldn't get another vaccine for 60 days, 3 months, whatever. It was a moving number, but we realized that in lieu of that, a lot of people didn't get vaccinated for a lot of things they should have gotten vaccinated for. Right. So now we're playing catch up to all the vaccines, not just for younger children, but for adults too. People didn't get their shingles vaccines, people didn't get their pneumococcal vaccines. So a lot of vaccines kind of went by the wayside. And even there were some people that weren't getting flu vaccines for the very same reason. So yes, now we don't prohibit you from getting any of those vaccines at the same time. So, and we treat you like a captive audience. If you're there, and we're going to get you vaccinated with everything we possibly can, because we don't always know when you're going to come back.
How should we manage holiday gatherings and visits with older relatives who are unvaccinated? My parents are unvaccinated. I am fully boosted. Should I continue to quarantine pre-visit?
I would just take extra care to protect them. I'm always like, you can never be faulted for doing too much, right? But you can always get caught if you don't do enough. So for older relatives, I have relatives in their 90s. I'm always very careful around them. I want to make sure that if I'm not feeling well, I'll let them know that, and because I work around sick people all day. So I don't, take something to them, or if I do go, sometimes I still wear a mask. I still do some hand washing. I just want to make sure they're protected because a lot of them aren't vaccinated and they're more at risk. And even your slight sniffle, which you don't think could be that bad, can be really bad in someone that's, very elderly.
In addition to that, I will also say, open the windows if you can and just get some more air circulating and, keep a little bit more distance if possible. And stagger the times that you eat if you guys are going to mask so that everyone isn't masked at the same time.
Right.
Are the expiration dates on the COVID test an indication that the results are not valid? Should all expired tests be discarded?
We're going to recommend that they should be. I mean, it's not like medicine that you're like food and oh, you can use it like a week or 2 past the shelf date. I wouldn't feel confident in the results if the test is expired.
We keep hearing on the news about a tridemic. What is the tridemic and should we be concerned?
I think the tridemic is more that we're putting RSV and COVID and influenza all in the same boat. I would only be concerned to the level of just being cautious and being mindful that there are ways to prevent getting these infections and lessen your likelihood to get them or be exposed to them. So, and the downside is they go peaks and valleys, right? So we do anticipate seeing some more flu and some more COVID, at least through the first of the year, because we're doing, holiday gatherings and more social events. And we're not going to tell you not to do those. We just want you to be careful and mindful, and you can pick and choose. If you're more comfortable with just sticking to family, that's fine, as opposed to doing the big holiday party or the big company party. And I'm not sure that everybody's gone back to that. But you do what's best for you and your comfort level, right? So if you're not comfortable going to big gatherings, then just keep it intimate and small and just keep it to your close inner circle and your family so that you can control that. Because once you do larger gatherings, We're not requiring tests anymore. We're not requiring masks anymore. We're not requiring you to show your vaccination card, so you don't know who's vaccinated and who's not. And nobody likes to get home from a vacation and not feel so hot and do a test and find out they were positive, which means you got exposed to somebody, you know, on your travels or at a dinner or another social gathering.
Are there still efforts being made to fully vaccinate the entire population in an effort to eradicate the disease, or will we approach COVID like the flu and continue to regularly boost everyone? I think every year people will get their flu get a flu vaccine and a COVID vaccine. Ideally, everyone will be vaccinated, but due to, I always say that like viruses, bacteria, they want to live like us. So they're going to find a way to live, and that's how they, cause these variants. So it's probably going to be likely that we will need a vaccine for COVID every year, just like flu. Right. Regarding RSV with infants, if their symptoms are more so the rapid breathing and fever, but no intense cough, would that still be characterized as possible RSV or more along the similarities for COVID?
I would say it's probably probably closer to COVID and regular cold. What sets RSV apart too is wheezing in the lower respiratory tract. So it's not just that they have cough and that they're breathing fast, but you'll actually, sometimes you can hear the wheezing without a stethoscope, but oftentimes you'll hear wheezing. The breathing will be very loud and it'll be very rapid. So even without the cough, they're just breathing so fast that they can't, and it's like running a marathon for a baby, and they've not trained for that, and they will poop out a lot faster than we would. So they can get into trouble and get really sick really fast.
We talked about this a little bit before. We do recommend getting the flu and COVID vaccine at the same time. And you also can get your booster and your flu shot at the same time. So that can all be one visit there. You don't have to wait between your booster shot and your flu shot.
No, not anymore.
Are there any medications known to alter the positive effects of the COVID vaccine?
I'm not positive. I'm not sure if I quite understand that. But no, there are not. So I might interpret that a different way. People always ask me, can you boost your immune system? I will tell you that you cannot boost your immune system like you can your cell signal or your internet coverage. Your body does a pretty good job of fighting off foreign invaders. It's just these are foreign invaders, mostly to Leanne's point, that are smart about, every year you try to put me down and I'm going to find a way to make my existence still an existence, right? So viruses are very savvy in changing a little bit of protein that we've not been exposed to make sure they stick around and they're more contagious. So the best things you can do to make sure you have a healthy, intact immune system, have a good diet, eat healthy foods, make sure you do your regular checkups, get your vaccines, right? And take really good care of your health, right? Because once you start having to fight off a lot of stuff, your immune system is really going to take a hit, but you can't boost it, but you can certainly do healthy things, have a healthy lifestyle, maintain a healthy weight, be active, right? And eat a lot of, healthy foods for you. I know there's a lot of money played into things like echinacea and zinc and vitamin C. All those things aren't harmful, but they don't have the massive benefits that we would like them to have, but they don't hurt you if you want to take them. But really the best things to do are prevention and making sure you eat well, sleep well, and make sure you have a healthy diet.
I believe that the next comment was in regards to free at-home test. So someone said that if you have school-age children, check with your local Board of Education. They have free tests for families. Twinsburg definitely does. Thank you for adding that into the chat.
Perfect.
Is the booster shot necessary? Is there a negative to not receiving the booster shot after being fully vaccinated? And is there a required time limit to receive a booster shot after being fully vaccinated?
No time limit for getting the booster shot. The downside is if you don't get a booster shot, then you're open to what's in the booster shot, right? So you can still get COVID. And people always ask, well, I'm fully vaccinated, I'm fully boosted, why did I still get COVID? Because you got to remember the Omicron, even though that is in the booster, is still very contagious. So even if you're boosted, you're fully vaccinated, COVID's still out there, it's still very contagious. So you can still get it. You're just not as likely to be as sick from COVID as getting it, but it finds a way to be incredibly contagious. And there's not just one Omicron. I was reading today, there's like several different versions of it. So, we're always going to be trying to catch up to what's the latest version. And like any vaccine for COVID, like we said for flu earlier, your immunity wears off at a certain point in time. So that's why, yes, you need to be vaccinated. Yes, your COVID booster needs to be up to date, because none of the immunity that you get for these is lifelong. Now, measles is different, right? So when you get your measles shot, that's a lifelong immunity. COVID's not like that. So we don't, if there may come a time when that one booster will protect you for a lot longer, but we're not there yet.
Are there any RSV home tests, or will people still need to see their provider for suspected virus?
Yeah, that one you'll still need to see for suspected virus because it has to be cultured in a lab, and we don't have that available as home testing. So you'll have to go to a healthcare provider and get a swab for that. Same for influenza. I don't believe there are flu home tests yet either.
I am not aware of any flu or
Yeah.
RSV home tests.
Mm-mm.
How do you think the current COVID outbreak will affect the U.S.?
I think there will be, unlike what's going on in China, we're not trying to do zero COVID, but I think there's always going to be mini surges. I think now we don't fear the surge like we did, and I don't think we'll get back to, last year when we had the worst surge, right? So I don't think there are going to be huge surges like that, but I think you're going to see minor peaks and valleys. We've had some surges this year already. We've had we monitor at all the hospital systems monitor by week, and we got back over 20% for a while in Cuyahoga County, had inched towards the red zone. And I, can't say a lot why. A lot of that might have been timed around kids going back to school, but it could be a lot of things. So we're going to see kind of peaks and valleys. We won't quite eradicate it, right? It's going to be around, but as long as we can manage it and treat it in some way and work to prevent it, it'll be a lot less frightening as it was before, because it was incredibly frightening for a time.
Is there a waiting period for COVID booster vaccines if you've recently had COVID?
There used to be, but there isn't anymore. So we say as long as you're feeling well, you can wait 2 weeks, but you don't have to. So if, you're fine 10 days after you have had COVID, you don't have fever, you don't have bad cough, you don't feel terribly fatigued, then it's okay for you to get your booster. And we prefer you get it sooner rather than later, because as we know, you can get COVID more than once if you're not protected.
Is it a myth that once you've had COVID, you're in the clear for 6 months?
No, we wish that was true. That's our hope and our goal. So we've tried to figure that out, and it's always been a moving target. We think you might be less likely to be reinfected in that time, but we've seen people reinfected in a lot less time. One thing we don't do is, back in the day when people would test positive for COVID and they would tell you not to retest for 90 days, that was actually a smart thought, because you can continue to shed small amounts of virus that aren't in enough load to be contagious, but are high enough for a test to pick it up. So if you think like you've got the kind of job that says, well, I'm not gonna let you come back to work until you test negative. Well, if you test weekly and you test positive every week for 90 days, you'll be out of a job, right? So, and then at the time when we didn't have a lot of tests, because that was the other issue, we had all these people that wanted to get tested, but not enough tests. We didn't have enough tests to do that. So the CDC went to, once you've cleared your isolation period or your quarantine period, we don't recommend that you repeat testing even now, because that test could still be positive and you're reacting to the test, not to the contagiousness or the illness.
And that also has to do with the fact that some of the variants, you had better immunity against those than other ones. So like the alpha variant and the beta variant, if you had alpha, you were more likely to be protected against beta, but that wasn't the case with Omicron. So that's another reason why your immunity might not be in the clear for 6 months.
Right.
The CDC recommends those who tested positive for COVID quarantine for 5 days. After the 5 days, positive people are allowed to go into public spaces as long as they're masked. Do you feel like 5 days of quarantine is enough?
Ooh, that's a good one. I honestly think not. I think that was done really a lot for economic reasons. People were still very much contagious in that 5-day window. It had to be done because I just think people were just losing their minds because they were losing so much money. But it really, 10 days was ideal. right? But you couldn't keep kids out of school that long. People couldn't, the workforce couldn't withstand it. I thought 10 days was better. Because remember, it used to be, I think, 2 weeks at one point, and then they got it down to 10 days and then went to 5 days. So they split the difference and said, okay, well, you can go back to work in 5 days, but you need to wear your mask in 5 days. I will tell you, most people don't. I mean, you know, they do the 5 days and they just go back to doing whatever they did before. So it's really a way to protect others from getting it from you when you go back. And I would love to see more strict mask wearing, because it's an easy thing to do. Even for people that don't get vaccinated, wearing a mask is not a bad thing. Because I don't know what people have and they don't know what I have or don't have. So that one's not hard, but I'd prefer the 10 days, and I have colleagues that would still love it for it to be 10 days, but we understand 5, but 5 home and 5 mask wearing is the recommendation.
What advice would you give to COVID long haulers who have experienced serious health issues as a result of contracting COVID and who have received mixed messages from healthcare professionals regarding taking the COVID vaccine?
I really do think they should, you know, you need to find a provider that validates your symptoms, right? So you don't want anyone to dismiss your long haul symptoms, because it's a real thing. People complain that they still have cough, they have shortness of breath, they still feel fatigued. There's brain fog, and you know, some of the worst complications are the multi-systemic illnesses, and people suffer blood clots. So I think it's really important that if you suffer from long COVID, you have a provider that validates that and supports you and gets you help where you need that. And you should still, I mean, I'm still in favor of getting the COVID vaccine, because unfortunately, if you've got long COVID, that could have been from one of the earlier variants. You still need to protect yourself from future variants, because those aren't going to go away. They're here to stay. Hopefully we'll never get anyone as bad as or as contagious as Omicron, but we don't know that. But long COVID is a real thing. And that's one way we do know COVID from flu, because flu is not long haul, right? But COVID can be. And sometimes those symptoms are just here to stay. A lot of the major health systems do have long COVID treatment centers. So they have, you know, made it a multidisciplinary specialty where there's, you know, doctors from all different kind of specialties, mostly pulmonary, which is the lungs, and rheumatology for joints, and just a way to kind of do a one-stop shop to make sure all of your healthcare needs are addressed. And one thing we can't stress enough, that, you know, during COVID, we let a lot of our own basic healthcare go by the wayside, right? So, you know, it takes me, honestly, I don't know if anybody on the call has the same issue. I went to my dentist in October. He said, yep, I can get you in for a cleaning in May. And I'm like, you mean May of next year? And he's like, yeah. So we've got to go back to getting your mammograms, getting your colonoscopies, getting your annual healthcare checkups, getting all your other vaccines, and just making sure that your regular day-to-day health isn't suffering because we can't get in, right? So be, you know, vigilant about basic healthcare, and that includes dental, and that includes women care. You know, get your male relatives to get to the doctor and get their PSAs checked, because we tend to let stuff go. We take care of everybody else first and ourselves last, and we've got to make sure we take care of ourselves too.
Another question about long COVID. It said that the vaccine may reverse some of those symptoms. Is there truth in this?
We wish it would, but it does not, because it's, if you think about it, once exposed to it, there's not a way to get it out of the body, right? So that the virus has done its damage. But there are other medications that you could probably take to ease those symptoms, you know, whether that's short bursts of steroids. I think we're still in the infancy of treating long COVID, but the best way to, you know, at least not try to minimize what's going on with your COVID is not to get another bout of active COVID on top of your long COVID. That's never pleasant.
Being that our immune system continues to neutralize and become used to antibodies, do you think vaccines will ever become not effective?
I don't think so. I think the difference between antibodies and, say, like antibiotics and medicines, it's the same thing, that why viruses make themselves different, right? So antibiotics work the same way. So anything we do to try to limit how a virus is spread, or how a virus replicates, or how a virus lives or dies, viruses are smart, and I can do something to evade whatever you're doing to try to put me down. So I don't think they'll ever not be effective, but I think we'll always be kind of chasing what's the best vaccine. I think in an ideal world, we would love to have one vaccine for everything. We just can't, make that all in one package. If you look at what kids get when they get their primary series, sometimes parents are horrified, and they got to get that many shots. I'm like, I know. I would love to have them all in one shot, right? But we're not there yet. But it's a lot less shots than it used to be, right? You used to have to get a lot more. And I don't think they'll ever not be effective. I think we're just always going to be living with microorganisms that are just as smart as we are. As we try to prevent them, they try to evade us. And sometimes we win and sometimes they win.
Does increased levels of iron, vitamin C, vitamin D, or zinc help fight off viruses?
No, they do not, but they do help I think for the most part, make you healthier, right? So there's no harm in taking any extra supplements as long as you don't take more than the recommended dose. I think vitamin D is one that goes just beyond what it does in viruses. It's an antioxidant. As you know, in Cleveland, we don't get a lot of vitamin D. We didn't get any today. And if we tested most people on the call, they're probably lower in vitamin D, right? And then we're not all milk drinkers, or we all can't drink milk, right? So you get a lot of vitamin D from that when you're growing up. So a lot of us are vitamin D depleted, and that is one we could certainly, not just for preventing viruses, but for prolonging your lifespan. That has a lot of healthful benefits. Vitamin C does help with some viruses, but you can get a lot of that in the foods you eat. So you don't have to take extra supplements if you boost the vitamin C content. And people take zinc around the time they get colds, and some people will swear by zinc. So none of them are harmful. Some of them are helpful. The thing is, they're not universal helpful for everyone. As long as you don't take more than the recommended dose, and it's perfectly fine to take those supplements.
There's talk about making the COVID shots as immunizations for the school-age children mandatory on their shot record. Is that a fact?
That is not a fact. We can barely get people to get the recommended vaccines on the school record, right? And we still allow people to consciously object to vaccines for all kinds of reasons. So as far as the state of Ohio goes, and that's not true, every state does their own thing and has their own rules, but they had really never entertained, and it went through like Ohio Department of Health, never entertained making COVID vaccines mandatory for school-age children.
Can RSV infect the same person more than once?
Yes, you can get it several times, but mostly it's a self-limited cold, and most children by the age of 2 have had at least one RSV infection. The reason why we don't know about it is because we don't test unless we need to know about it, right? So if you're going to hospitalize a child, or there's daycare outbreaks, it's an easy test to do and to get. But most people have RSV and don't even know they have RSV or have had RSV.
Is 90 days still the time frame to wait before retesting for reinfection for COVID?
So now the recommendation is not to retest, right? So 90 days was the limit. So now we say don't do it at all. But if you're going to do it, we would say wait the 90 days.
Do we have less COVID infections today, or is the infection rate the same?
I think we definitely have less COVID infections today. We have less deaths from COVID. I still get a weekly report from the coroner. So where it had been, multiple deaths related to COVID back in the high point of the epidemic, now it's only, 1 or 2 a week. So the infection rate has stabilized and fallen off. And I think the positivity rate in Cleveland right now is somewhere between 12 and 15%. So it's lower, and that might uptick a little bit, but it is much stable. And the good news is people are getting less sick from it, fewer hospitalizations from it, less severe disease, still contagious, but a lot less burden of illness than it used to be.
At the height of the pandemic, the type of mask you wore mattered. Is that still the case?
No, you can wear a basic surgical mask, so you don't have to get the KN95 or the reverse respirator. Probably those KN95s are superior to cloth masks. Cloth masks are not that great, but certainly were superior to bandanas, right? Because people were doing that. And I saw all kinds of interesting things. I saw people come into the grocery store with like firefighter masks on. So you don't have to go to that level, but I think, you know, just a basic mask. I will tell you, if you do order masks, that you make sure that they're certified masks. I've had people order, you know, off of Amazon and get masks where the printing was upside down or was in a foreign language. And so, you know, you can get masks at the drugstore, and they're easy to get now. So there's not one that's superior. The KN95 is probably the best one and safest. But even if you do a cloth mask, that's superior to no facial covering at all.
While precautions for the general public have relaxed significantly, it has not really changed within the hospital setting. Do you foresee masking as permanent for healthcare providers?
I think it's going to be there for a very long time. And I'm amazed sometimes when people come into a healthcare setting without a mask and get upset when we ask them to put on a mask. I'm like, you're in a healthcare setting, right? So you may not be sick, but people in the waiting room may be sick. People in the hallways may be sick. So at least for the foreseeable future, none of the health systems are going to remove the mask mandate. They've, you know, lifted the restrictions on visitors and things like that, but in the healthcare facility, we'll still be doing mask wearing for quite a while.
Someone just wanted to reiterate in the chat that if you are experiencing long haul symptoms, that there are clinics that you can get linked into for management of those symptoms. You mentioned that the U.S. leans on Australia when looking for influenza trends in preparation for flu season. My question is, why Australia, and are there other countries that U.S. may have on their radar?
Australia, that's because the seasonality of when their flu peaks isn't enough time for us to develop our vaccines. So they're ahead of us in that time. We haven't looked to other countries as far as flu, but we looked to other countries for COVID. So remember when COVID started, not in China not being the exception, but when the variant started coming out, we were looking at South America, Africa, and Great Britain were areas where they were seeing the variants before they hit the US in significant enough time for us to know that they were coming. But flu has always been like more Australia just because of the peak and where the season is, their seasons are. It's just more reflective of what we get in this country. But we did look to other countries for COVID peaks and COVID variants.
How come, why did they stop the daily reporting of COVID numbers on news platforms?
Because the numbers had stabilized and it wasn't, you know, part of it is people weren't tracking it as much too. Even the public health department doesn't do it daily anymore. They do usually down to weekly. And you can go to the Ohio Department of Public Health website and they update it, I believe, like every Tuesday. And it's almost similar like what they did with monkeypox. For a while, monkeypox got reported every day, but now that's gone back to, you know, we do it every week. It's just because the numbers have stabilized, so they don't track it as much.
Currently, there's an explosion of COVID in China. Should we be concerned? So China has like a zero COVID policy number. So they don't want any COVID at all. So any number that they see that they're gonna do a major lockdown. And so I don't think that their numbers are any more than us. They just don't want any COVID there.
Right. And then what they're protesting is the return to severe restrictions, right? So think of it, it wouldn't be any different in this country if all of a sudden all the state governors started going back to, okay, now everybody's got to wear a mask. Everybody's got to socially distance. I don't think anybody would be willing to go back to that. And we barely were able to get done what we got done at some point, right? So nobody's going to go back to that. And she's right that China has, like, they want no COVID, right? And that's not realistic either. So what people are really protesting against is the having to go back to, you know, I mean, really strict social distancing and masking and, you know, fewer interactions and all that. And we're never going to get back to that in this country.
You mentioned some of those supplements will not help fight off viruses. What else can we do other than vaccines to fight off virus?
Lots of good hand hygiene, lots of limiting exposure, taking care of yourself when you're ill, right? So when you have symptoms, making sure you rest, making sure you have fluids. If you're ill, go see your health provider because sometimes testing you early can get you treated early. So the things I think we do for COVID now are Paxlovid. Somebody asked about Remdesivir, I can never say that one correctly.
Remdesivir.
Yeah, I think there were more side effects with that and not as readily available was the problem, because I think some of the ones that came out earlier, you know, you had to do infusions and clinics, and it was hard to get a lot of that navigated and arranged. So Paxlovid is an easy one to do. Tamiflu is an easy one for flu. So the importance of recognizing your illness, but preventing it just with basic stuff. I tell everybody, you know what we used to do before hand sanitizers? We washed our hands with soap. So we need to go back to good old fashioned hand washing, you know, making sure surfaces are clean, making sure we teach people how to blow their noses properly, how to cover their mouths and noses when they cough and sneeze properly, how to take care of yourself when you're sick, right? And to minimize not just your ability to get illness, but your ability to spread illness will go a long way towards making sure we protect everyone.
How is it that some who have tested positive for COVID test negative in 5 days or more?
Couple of reasons. Sometimes the burden is gone. There, you know, you can have false positive results and false negative results, right? So it's possible that, you know, when you tested, you had a high infectious burden at that time, and then 5 days later you didn't. Some people will shed a lot of virus early, and then some people won't shed as much virus later. So it's not predictable, and sometimes a lot will go by, you know, how are you feeling, right? So you can still test positive or negative and still feel awful, right? Doesn't mean you have active COVID anymore. It takes you a while to get longer. You know how it is in your house. If like 5 people get the flu, there's one that's like literally like the worst case of flu ever. And then there's one that's like, yeah, you know, it's not so bad. I don't feel so bad. Like everybody else has it worse than I do. So it's variable. It's variable.
The next question is about how does remdesivir treat COVID? So remdesivir is an antiviral that inhibits viral replication. So it's only available IV. The treatment course is usually 5 days. There is a study that shows like 3 days will prevent hospitalization. So it's pretty much decreases some of that symptoms kind of the same as Tamiflu and Paxlovid. They all kind of work the same and decreases some of those symptoms that you have from the disease.
All right. So how to think of those treatments are what they typically do is shorten the disease burden, the time that you're sick, right? So it's not like taking an antibiotic for a strep throat infection. So it doesn't necessarily kill what you've got, but it does shorten the duration that you're sick.
What would your recommendation be for African-American women in fighting COVID or any similar virus?
We really do just have to be mindful of looking out for signs, right? Making sure that we're vaccinated. And for those that don't get vaccinated, I mean, and that's still a complicated, you know, subject. I know somebody had asked about, you know, are we ever all going to get vaccinated? And certainly the push to get vaccinated has died down. As you know, there was a heavy push, you know, there's all this publicity and PR work trying to get everybody vaccinated. We've made some slow movement on that, but I think the numbers are going to go down to this. There's probably a lot, the ones that want to get vaccinated have gotten vaccinated, and the ones that are thinking about it are still thinking about it. And then there are ones that are just never going to get vaccinated, right? So the best thing we can do as women is to, you know, if you choose to get vaccinated, get vaccinated. If you choose not to, make sure that you do the necessary steps to protect your health. And especially if you live with older populations or younger kids, that you protect them and protect yourself. So just, you know, practice basic hand hygiene, cleaning surfaces, limiting exposure, distancing when you can, and limiting your social circle, especially during the holidays, you know, when you don't know if everybody's vaccinated or not, just to make sure the exposure isn't increased.
Has there been an increase in mortality rates in infants with RSV this year more than previous years? If so, any idea why? So last year, because past 2 years, everyone was masked and all of that, there wasn't a lot of children that developed RSV because we had good hygiene and we're distancing. So in previous years, RSV has been about the same. It just seems worse this year because we haven't had RSV in 2 years. So that's the primary reason why it seems like it's a higher mortality rate, but it's pretty much the same all the years previously.
All right, it's just the incidence is higher. And the same with flu. We didn't see a lot of flu in COVID peak years because we weren't going anywhere and doing anything, and we weren't out and exposed. And all that has just opened up our, you know, likelihood of getting it or spreading it. So you're seeing more because we're out more.
And then what symptoms should you look for in children with RSV?
So look for a cold that looks different than a cold, right? So it's not just your cough and your runny nose. Kids that are getting significant, severe RSV will be breathing very fast. Sometimes the cough will be nonstop. Sometimes they'll be coughing and breathing so fast that they don't keep up nourishment, don't keep up fluids. That would be in a younger infant, that would be fewer wet diapers, right? They're starting to get dehydrated, starting to look a lot sicker, right? So for most kids, it just looks like a common cold like every other cold. But for younger children, and especially those that are 6 months and under and those that were born premature, they're going to have a lot more respiratory disease and more severe respiratory disease.
African Americans were reportedly to have the most severe symptoms and experience death due to COVID than white counterparts. Is this still the case, and what do you believe is the cause of this?
It's less the case, but the reason why it had been in the beginning, we're a lot sicker, right? COVID in the early days took out people that had comorbid conditions. So obesity, people that had diabetes, people that had chronic lung conditions, congestive heart failure. So all of us know that as an African-American people, we are not the healthiest group of people. Our access to healthcare is not as good. So when we get sick, we get really sick. And sometimes we wait till we're really sick to go to the doctor. So COVID didn't just take out a lot of older people, it took out younger people too. These were people that had been healthy sometimes right before they got COVID, and then unfortunately took a downturn. So we're seeing less mortality from it, but still the reason why we, pushed vaccines so hard, because we wanted to prevent severe disease. And what the vaccine did was to prevent you from getting as sick. You could still get COVID, but you weren't as at an increased risk to be hospitalized, to be intubated, right, put on a ventilator, or to die from COVID had you not been vaccinated. And unfortunately, we still have people that pass from COVID because they're still the older, sicker, their immune systems aren't great, their healthcare is not great, and they get, a bout of COVID that just takes them out. Less of it, but still present. So it makes sense to do what you can to try to prevent getting severe disease, and try to protect yourself from others, right? Because I tell people all the time, you can get COVID and you don't get to choose what kind of COVID you get, right? So everybody hopes that they get a little cough, a little sniffle, that you don't get you don't get intubated, you don't get put on a ventilator, you don't come out with long haul, but we don't get to choose, right? So if you get it, hopefully that it's a lot less severe nowadays, but it doesn't mean that it won't always be that way.
How should daycares handle RSV for children and adults attending there?
I know we've gotten outbreaks of RSV in daycares, and typically what they want, so if your child has a fever, anybody with a fever shouldn't go to work or go to a daycare, right? So as long as the coughing is not to the point that the child is throwing up or getting dehydrated and doesn't require extra support because they're so sick, they're allowed to return if they don't have fever, and probably get a clearance from a healthcare provider just to make sure they're okay to go back. Probably many of this on this call remember back in the day when we had chickenpox parties. Yeah, nobody does that anymore, right? But the whole point of chickenpox parties was everybody had it all around the same time. Everybody got sick around the same time. So it wasn't a big outbreak, right? It happened, it was done, it was over. We all went back to work, they all went back to school. Nobody's going to do that now. So what daycares are unfortunately forced to do is, like, one kid's got it, they got to stay out because they're trying to limit the spread to everybody else in the daycare. So they do notify parents that there is an outbreak of RSV. They tell you to watch for symptoms in your child and have your child seen by a healthcare provider to make sure that they're not sick enough to stay out and that they're okay to come back.
Does elderberry and sea moss truly help boost the immune system and reduce the chances of testing positive for COVID?
It can provide other health benefits, but it doesn't boost your immune system, and COVID does not have any, it doesn't affect COVID in any way. So it's sad to say.
If a baby has RSV, what implications of contagion can a toddler have on other kids and adults?
Usually the illness in older toddler children and adults is less than it is for the younger infant. So the older child, say the toddler like that's between 2 and 4 is just going to get a cough and a mild runny nose. Same for adults. The only time we worry about adults if they should trend over into pneumonia. And those are our sicker adults, right? So those are our adults with COPD and congestive heart failure, and who may or may not be vaccinated against flu, right? If they get a respiratory illness, unfortunately, their illnesses can turn into pneumonia very easily. So you want to watch out for symptoms like difficulty breathing, rapid breathing, chest pain, bringing up awful sputum, high fever, shaking chills. Those are kinds of things that make us think that your RSV is not just RSV anymore. It's trickled over into a superimposed bacterial infection or a pneumonia.
And a related statement here in the chat. A few reminders when seeking medical care this respiratory season. Wait times are longer, so be patient. If one person in the household has COVID, everyone does not need to be tested. Everyone should be quarantined. Okay, the next, they have stopped mandating masks on flights and public transportation. Being that there's a rise in travel, do you think this is the #1 cause of positive COVID cases?
I think it's contributing. Even though they've remove the mandate that you should wear a mask, you can always choose to wear a mask, right? So you don't need anybody to tell you to do that. But yeah, I'm sure it has contributed. I didn't like plane travel before COVID, right? Because it's manufactured air. There's always somebody sitting behind you hacking up a lobe of a lung, and not covering their mouth, and I don't know what they did in the bathroom. So it was never all that. And remember, they didn't clean as much before COVID. So now, if you ask, and for a while they were putting, wipes on every seat. Now, if you ask them for a wipe, you get a wipe. I take my own wipes, right? So I'm just like the person next to me that's wiping down the tray table and the armrests and all of that stuff, just because it makes me feel better. But so yeah, you don't have to wear it, and they make that announcement. They say, so we are no longer requiring you to wear a mask, but you can if you choose to do so. And if you do, keep it on, except take it off when you're eating and drinking, and then put your mask back on. But I do think that opportunity to spread, and as you know, the travel numbers are now almost back to where they were before COVID. So that's a lot of opportunity for COVID to take advantage of an open and available audience for that.
And the final question is, do you recommend pregnant women to receive the COVID vaccine?
I do, and the American College of Obstetrics and Gynecology does also. Unfortunately, there were women that passed away from COVID while they were pregnant, before they even got to see their babies. So yeah, we don't, know that COVID is more severe if you're pregnant, but we want to prevent that complication if we can. So there is no harm to the fetus. None of the vaccine passes to the baby. And we even know if you, heaven forbid, have COVID after you're pregnant and you're breastfeeding, it's not transmitted in breast milk. But the best way to prevent even getting the disease is to get vaccinated in the first place.
Thank you. Leanne and Lynn Soares, we just have to say thank you on behalf of the Physical and Mental Health Committee. You guys have answered, I counted about 46 questions. And that's really what our goal was to allow the opportunity to have a community conversation. It's very rare that you get to speak with a pharmacist and a doctor for over an hour about questions that you have. So we just want to say thank you. We appreciate you volunteering your time to really share vital information with the community. And so before Leanne wrapped up, I'm like, please let me just thank you all. I really mean it. We appreciate all your expertise, and it's a lot of Black girl magic happening right now. So we are very, very fortunate. Thank you.
Thank you.
Thank you. Thank you all for attending. We hope that the information shared today from our trusted voices have helped you to be informed about COVID-19, influenza, and RSV. We encourage you to refer to the CDC, Cuyahoga County, or Cleveland Department of Public Health for more information about COVID-19, influenza, and RSV, or to contact your healthcare provider. Thank you all again, and good night.